I'm Dr. Joe Polpeter. I'm a family physician here in Marshalltown, Iowa with the McFarland Clinic. Adults often make the mistake of thinking that immunizations are just for kids. Of course, vaccines for kids have been game changers in the fights against awful diseases like polio, diphtheria, and rubella. But there are important vaccines for adults as well. These help keep us healthy, and let's quickly go over these major ones. First, we have to talk about the influenza vaccine, which we all know as the flu shot. The CDC recommends this for everyone every year, and it's even more important in this age of COVID. That's because we need to decrease the risk to our respiratory system. After all, the flu vaccine doesn't just reduce the risk of illness, but it prevents hospitalizations and death. It doesn't take long, and it really is your best bet at staying healthy, avoiding unpleasant symptoms, and keeping others safe. Adults may also need a Tdap, which protects against some very bad diseases such as tetanus, diphtheria, and pertussis. Tetanus causes painful stiffening of the muscles and leads to serious health problems, including being unable to open your mouth, trouble swallowing, breathing, or even death. Diphtheria can lead to difficulty breathing, heart failure, paralysis, or death. And pertussis, often known as whooping cough, causes uncontrollable and violent coughing that makes it hard to breathe, eat, or drink. To be clear, the Tdap vaccine is commonly given to children ages 7 and older. Receiving this vaccine as an adult not only helps to protect the recipient, but also helps to decrease the passage of these horrible diseases to other infants. This vaccine is recommended to be boosted every 10 years. For older Americans, there are two other key vaccines. First, often called Pneumovax, which helps prevent diseases caused by the bacteria called Pneumococcus pneumoniae. Helps protect against things such as pneumonia, meningitis, sinus infections, and more. Many of these diseases are mild, but some can be deadly or result in long-term problems. It is wise to play it safe by getting vaccinated. This vaccine is recommended as a one-time dose for those over 65 and for others with certain medical conditions. Likewise, there are several different formulations of this vaccine currently available. Check with your primary care provider about what you need and when. The last shot I'm going to discuss is for shingles, which is given to those over the age of 50. Shingles is due to the reactivation of the chickenpox we all had as a child. It is a painful, burning, and blistering rash that can develop anywhere in your body. Some people battle pain for months or even years. If the shingles develops in your eye, it can even cause blindness. To prevent this, we commonly give 2 doses of the vaccine called Shingrix, which is 90% effective at preventing this disease. And for those who still get the disease, it is almost always relatively mild. Furthermore, its immunity stays strong for at least the first 10 years. There are currently no recommendations for subsequent boosters. Do note that some adults with specific health conditions shouldn't get certain vaccines, or should at least wait to get them. Talk to your provider about what's best for you. It is my hope that you now have a better appreciation of vaccines and the critical role that they play in keeping us healthy. I strongly encourage you to get all the vaccinations recommended by your primary care provider. They're safe and effective, and that's why I've always been immunized whenever my provider tells me that I'm due. If you don't have a primary care provider, the Marshall County Public Health Department can help. Call 641-844-2799 or find the Public Health Department online at marshallcountyia.gov. Stay safe and be well.